Welcome to the PermaDontics Center, Southern California's premier dental implant center. I'm Kim Morrison, and today I want to share with you a PermaDontics same-day teeth success story. Archie Moore Jr. is the son of San Diego boxing legend Archie Moore, former light heavyweight champion of the world. For years, Archie Moore Jr. knew he had to deal with his failing teeth. Health issues and a fear of the dentist had caused severe tooth decay and multiple missing teeth. Recently, Archie came to a conclusion. He realized that his famous father never let anything stand in the way of his goals and that he shouldn't either. After researching and visiting several dental implant providers, Archie chose PermaDontics. This is his story.
I heard about PermaDontics through my cardiologist who had dental work done there. And so I went to them, and the office was so pleasant when I walked in, I felt like I should have been there in the first place. And after talking to them and going through the x-rays and the people within the staff there, made me feel real comfortable.
When I first consulted with Archie, I realized that his cardiologist had actually referred him here, realizing that he had really bad gum disease and that this would be affecting his heart. And so the cardiologist referred Archie here to have the teeth extracted, which would reduce any further risks on his heart.
Your dental affects your health, your eyes, your sinuses, your taste, everything. And I had lost my taste, I lost my smell.
So Archie had a lot of missing teeth. He also had a lot of teeth that were loose, and he also had a lot of decay. He had gum disease. He really had a lot of stuff going on that was not good. Archie knew about it, and he kept delaying it. And at the age of 70, he finally decided he's going to do something about it. He was told he's going to have to lose his teeth. Dentists previously had told him that he's going to have to wear dentures. And so he was looking for a solution. And when he heard about us, he realized that actually he could get permanent teeth done in the same day. And he wouldn't have to go through a series of dental work and multiple visits with the dentist, that this could be all done right away and he wouldn't have to worry about his teeth anymore. Studies have shown that patients with gum disease have an increased risk of heart problems. So specifically in Archie's case, he had loose teeth with gum disease. And so the bacteria then can get incorporated into the heart. So what we do by taking out the teeth is we clean out all that area and we reduce the risk of any future heart problems.
Your dental hygiene is a must. You cannot neglect it any more than you have if you've been doing that, but I think a plus would be for the implants. If it would be your way to improve your health. I don't think it's ever too late.
So what we do here is we take a 3D scan of Archie's jaws, and then from the 3D scan we're able to make a perfect medical model, an exact duplicate of Archie's mouth. Then Dr. Berger does the surgery on the 3D model first. And this way he learns a lot about the patient, a lot about Archie's mouth, where the nerves are, where the sinuses are. And then we make a template of Dr. Berger's surgery that we use in the surgical procedure. This way the surgery is very safe and it goes very efficiently. Like Archie, a lot of our patients are senior citizens. They do have health issues. Dr. Berger, our oral surgeon, is also a medical doctor. So he does a thorough pre-screening with the patients, and then he works in tandem with the patient's doctors. In Archie's case, Dr. Berger called his cardiologist directly because Archie has a pacemaker. And this way we were able to do the surgery in a very safe manner.
Well, the doctors, I have to admit, were more prepared than I thought they would be. They coordinated all my surgery and everything with my cardiologist. And so they had a conference as far as my condition and everything. And I was quite pleased to know that they had done that, which made me feel a lot more comfortable coming here.
Archie has a pacemaker, and therefore he's on Coumadin. Okay, so that was the main issue. We had to be able to take him off the Coumadin for the surgery and then get him back on the Coumadin. And so Dr. Berger worked very closely with his cardiologist to ensure that everything went really safely. What I did with Archie is I sat down with him, I took all the measurements, and then we decided together what would be the best size, the best shape for him, and obviously the best color. And so we came up with what we thought would be the best, and then that information is then relayed to my technician, who then sets the teeth according to my specifications. When Archie came in on the day of his surgery, he was greeted by a registered nurse who is one of our team members. His blood pressure and his vital signs are taken, and then the anesthesiologist meets him. The anesthesiologist goes through his medical history and makes sure that everything is safe. Archie is then taken into the actual operating room where he's put to sleep, and the surgery starts.
On the day of my surgery, I was taken care of very well. I mean, there wasn't much I needed to do but get here. And they took care of everything else, all the other procedures, getting me set up. I had no problem at all.
The main thing is that we have an anesthesiologist who comes in when we do the procedures and puts him to sleep. So they don't have to worry about having dental work done in the normal fashion. So we do everything in one day. Patients are asleep, and they basically wake up with their teeth. And so that way they don't have to worry about getting shots, getting drilling, or any of the normal dental work that's done.
Well, there is a surprise factor involved because you hear it, and it's true. One day when I left here that afternoon, I had my teeth in place. And so I was really surprised, kind of taken back that it could happen.
Well, I think Archie was very surprised when he first saw his teeth the day of the surgery. Even though he was a little bit asleep, he was still kind of waking up, you could still see that smile, which really tickles me when I see that.
When I saw my teeth for the first time, after Dr. Ayers had finished the surgery, I was very, very pleased, overwhelmed. In fact, it almost brought tears to my eyes that my teeth were like they should have been all along.
For me, when I saw Archie a week later, that's really when it kicks in and gives me a real sense of accomplishment, that I'm able to actually improve not just his teeth, but his whole life. I could see a total change in Archie's demeanor. Initially when he came in, he was a little bit kind of down, but it just took 1 week, and you could see already he was a different person. He was much more alive, much more active, and much more engaged, I would say, in the world.
My confidence level is up now where I'm able to speak to people without having any negative feeling about myself. And in this job, it does help because I have to deal with not a lot of people every day, but I do have to deal with people. And it gives me a little bit more confidence being able to deal with them one-on-one and not have to hide my mouth. Well, the one-day factor is true, and it was done in 1 day. And when I left here, it was evident that it can be done in 1 day and without a lot of discomfort or pain. It's a newness to me that I've always had to hide my smile or never looked at anybody directly and spoke to them. Now I have no problem. And I have to make myself kind of ease up a little bit because I don't want to overdo it. Well, you know, I've learned to smile a lot more. I've had to learn to smile because for so long I hid my smile. I hid my teeth. But now that I have these new teeth, I love it.
Over the years, we've discovered that there are many different reasons that people seek out PermaDontics. Some want to be able to smile with confidence, some to be more comfortable out in public, others want to be able to regain the ability to eat the foods they like. Whatever the reason, they are all glad they took the first step to call PermaDontics. If you or a loved one has missing teeth, decaying teeth, or is faced with wearing uncomfortable dentures for the rest of their lives, contact PermaDontics and schedule your complimentary consultation today. You have nothing to lose and everything to gain. But don't just take my word for it. Listen to what some recent PermaDontics patients have to say.
Now I feel like a new healthy person, and my teeth are absolutely stunning.
Now I'm looking good, doing great, and back to doing what I love to do best, playing music with a big smile.
I'm social again and really enjoying life. Thanks to PermaDontics, I have my smile back.
Sometimes I have to pinch myself. I got my self-confidence back. It's the best thing I've ever done for myself.
The results are fantastic. People think I had a facelift.
Knowing what I do know now in regards to implants, dental implants, I would have pursued it a lot earlier.